More than 1 in every 3 Americans had their healthcare records stolen or compromised last year, making 2023 the worst year on record for cyber attacks against the healthcare field. So far, that is. If anyone thought 2024 would turn out better, February's cyber attack against Change Healthcare, still causing widespread problems throughout the healthcare system, does not seem like a promising start for improvement. When such cybercrimes occur, however, it's easy to lose sight of the fact that hospitals are not the primary source of data theft attacks. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. For the bad guys, the backdoor into the protected systems of hospitals and health systems often comes via a third party. That could be a business associate, solution provider, or some other entity. In this podcast, hosted by John Riggi, the AHA's National Advisor for Cybersecurity and Risk, we learn more about the risks posed by third parties from 2 cybersecurity experts with Providence, a large not-for-profit healthcare system operating multiple hospitals and medical clinics across 7 states.
Thanks, Tom. Thanks for everybody joining again today for hopefully another very interesting podcast. And we have some very special guests here with us today. We have Adam Zoller, the Chief Information Security Officer from Providence. And we also have Katie Adams, the Cybersecurity Director for Clinical Technology Services at Providence. Adam, great to have you here with us. Well-known, well-respected within the entire cybersecurity community. Long history in technology, including with the U.S. Army, as I recall. Adam, could you tell us a little bit about your background?
Thanks, John. Really happy to be here, and thank you for the kind words. Yeah, Adam Zoller, like you said, I'm the CISO at Providence, and I've been with Providence for about 4.5 years. And prior to that, I was in the U.S. federal government space, both on the government employee side of the house and in the consulting side of the house, doing cybersecurity for the federal government, what's now the CISO organization, and then pivoted over into the commercial sector. I served several years at General Electric in various roles in various companies under GE. And like I said, now at Providence. So happy to be here.
Great. Thanks. Great to have you here, Adam. And Katie, great to have you here as well. I know you've got a tremendously difficult job, as all of us do, but especially you in the medical device space. Could you tell us a little bit about your background?
Absolutely, John. Thanks so much for the opportunity. So, my name is Katie Adams, and I am the Director of Cybersecurity for Clinical Technology Services here at Providence. And I'm actually relatively new to the cybersecurity world. So, I've worked at Providence in project management and healthcare operations for a little over 12 years now, and just stepped into this role in the last year and a half or so. In my role, I really work to bridge the gap between technology and patient care to promote cybersecurity throughout the organization. So, looking forward to the conversation.
Thank you, Katie. Again, great to have you here. And this is a very, very timely conversation that we're about to have. Fortunately and unfortunately, as I said, your expertise is in high demand right now. And this is a very significant area of interest, especially when it comes to third-party risk, which we'll be talking about today. And let me back up a little bit and talk about 2023 and the types of attacks we've seen in the volume and sophistication of these attacks and the attack vectors. So 2023, unfortunately, the worst year on record for cyber attacks targeting healthcare and hospitals specifically. Largest number of protected health information data breaches ever. 126 million Americans had their healthcare records stolen or compromised last year. Ransomware attacks up 300%. Ransomware attacks accompanied by data theft as well. And of course, data extortion attacks. The ransomware attacks are the type of cyber attacks we're most concerned about because they result in, as we've seen over and over again, significant disruption and delay to healthcare delivery, risking patient safety. But when I look at the numbers, Adam and Katie, there's a lot of stories behind the numbers. When you dig deeper, you realize, one, hospitals are not the primary source of data theft attacks. It's actually business associates, third parties, and other types of healthcare providers. And you dig a little further and you see that not only is it the business associates that are being targeted quite heavily, it's third-party technology and solution providers that are often the attack vector and the source of technical vulnerabilities, which lead to other types of attacks. And unfortunately, 2024 is not shaping up to be any better than 2023. Lots of reasons for that. Let's take a deeper dive on third party risk management and especially an organization your side. Adam, if I could start with you, how does third party risk manifest itself in a hospital system the size of Providence?
Yeah, that's a great question. As you mentioned, hospital systems, healthcare providers, we're incredibly reliant on third parties to deliver critical services to our patients, especially in Providence's case, the communities that we serve within and the poor and the vulnerable. And this results in these attacks against third parties, and the risk results in lost productivity, both on the clinical side, but also on the IT and security team side. I spend a tremendous amount of my time, and my team spends a tremendous amount of their time both assessing and addressing third party security risk before third parties are onboarded. And then after the third parties are onboarded, we spend a tremendous amount of time managing risk. As you mentioned, a lot of these attacks are coming in through the third party angle, whether it's reportable events like data theft events impacting business associates, or the regulatory risk that third parties introduce into our ecosystem, or managing reputational impact of third parties that introduce risk into our organization or get compromised, managing that reputational impact that results of that. And then, of course, the direct incident side of the house, from a third party perspective, we deal with a number of third party incidents. Like you said, 2023 was kind of a standout year when it comes to incident volume. In 2024, we're seeing, if not the same incident volume, but in the first couple months, and an increase in the first couple months as far as incident volume is concerned. And we're seeing incidents that span the entire gamut of types of incidents you can imagine, things like data theft, data loss that require us to report to regulators, or impactful incidents like ransomware events that impact third parties. And these ransomware events can result in anywhere between a week of downtime for that particular third party to upward of a month of downtime for that third party. And when you're talking critical services that clinicians rely upon to deliver care, that can be very impactful.
Yeah, thank you for that, Adam. Absolutely right. And again, we have seen the impacts that ransomware attacks have on third parties. As you said, if they are mission critical, or as I say, life critical in some instances, the bad guys have figured out. Again, we're talking bad guys that are primarily based in Russia when it comes to ransomware groups. They understand if they attack a key third party strategic node, let's say like an oncology software provider, or a timekeeping service, or many other, or a quote unquote secure file transfer system. They know that gives them access to many organizations, and the disruption is magnified, thereby forcing that third party in a very difficult position, perhaps to pay the ransom. So we talked about clinical impact, Katie. That's your life and your world. Talk to us about how third party risk manifests itself on the clinical side of Providence.
Yeah, absolutely, John. I think just to add on to what Adam was saying, it really takes a village to deliver quality healthcare to our patients and our communities. And when third party systems go down, whether that's inside of Providence or whether it's vendors that are delivering critical care and critical services to our patients and our caregivers, it has a big impact on the organization. We're looking at rescheduling patients for critical appointments. You mentioned oncology patients in the cancer space, those treatments are really time sensitive. And so if we need to end up delaying their care as the result of a cybersecurity incident, it's a significant impact on our patients and our organization.
Yeah, thanks for Katie. And again, for pointing that out. It is the delay, disruption to healthcare delivery by these cyber attacks, which creates the risk to patient safety. I say this all the time to anybody who'll listen, including my current and former colleagues at the FBI and across all government agencies. A ransomware attack on a hospital or one of our mission critical third party providers is not a data theft crime. It is not a white collar crime. It is a threat to life crime. We understand the impacts. We see them constantly. Adam, let me get back to you for a minute. So, Providence, massive system, multi billion dollar, multi state system. And I would assume that you all should not have any issues dealing with third parties at all, that you have it all under control. You have everything you need, and those third parties simply adhere to any request you make. I don't think that's the case, but so given your size, let's talk about how do you manage third party supplier risk at scale?
Yeah, Providence, like other hospital systems, deals with a lot of the same sort of issues and incidents, I would imagine, that we're seeing sector wide. So when we talk about managing third party supplier risk at scale, I think there's aspects of the people side of the house, which I won't really touch on, but process certainly. And then on the technical front, managing technical risk that third parties introduce also comes into play. So I think where I would start is number one, just generally speaking, kind of on the people and process side, consolidation of roles and responsibilities when it comes to how you manage third party risk in a healthcare system. We've consolidated at Providence all the roles and responsibilities for clinical engineering under one accountable leader. And that accountable leader rolls up to the same accountable leader as cybersecurity at Providence. So, my boss, BJ Moore, the CIO, a huge proponent of cybersecurity and of managing clinical risk, is now accountable for both the clinical aspects of device management and engineering, but then also the cybersecurity aspects of the clinical device space and the third party application space. And by having that consolidated level of roles and responsibilities up to one accountable leader, then you don't run into the same prioritization issues that I think a lot of my brethren in this space are dealing with. I would say also a security culture. A lot of security organizations kind of operate in the shadows and don't like to share their priorities or don't like to share the compensating controls that they have in place for cybersecurity, or don't like to frankly share that we're having cybersecurity incidents very openly that are targeting either clinical devices or third party applications or third party services. And we've taken a bit of a different approach at Providence, and that's an approach of not necessarily oversharing because there is risk to oversharing, but sharing with the appropriate level of individuals in our organization that we are facing cyber events and what we're doing specifically about those cyber events and what we're doing specifically to manage the risks. And I would also just generally say it's easier to catch issues on the way in than manage issues that are already in your environment. And what I mean by that is having strong controls for vendor onboarding and third party risk assessments and architecture assessments up front so that you're managing the risk that you accept when the vendors get onboarded into your ecosystem versus having to go play catch up and clean up after the fact makes it much, much easier. To that end, centralizing purchasing power in your organization is going to be a strong lever that you can pull to manage the risk that you're bringing into your environment. Because if somebody in the field can't go out and buy whatever they want without going through the security process, that's going to prevent a lot of security risk from being inherited into your ecosystem. And then also, I would say, just lastly, proactively address vendor security challenges and challenge the vendors when they come to you with proposed solutions that are insecure.
Thanks, Adam, for that. A couple of key points you mentioned, I think that are worth repeating. One, the consolidation of clinical engineering and cybersecurity under the same accountable leader, the chief information officer. We have seen a lot of institutions moving to that model to eliminate the gap. Because quite frankly, we have seen in the other alternate structure where clinical engineering, biomed are totally separate, not managed by chief information officer. There is a gap in communication and visibility to the vulnerabilities, even in inventory, networks, and so forth, that the bad guys exploit. They have exploited very frequently. Katie, what are your thoughts on all of that? That Adam, gave us a great overview picture. How does that impact you directly?
Yeah, absolutely, John. Well, I actually wanted to go back to, I think part of your original question that's really important to call out is how do we manage risk at scale? Providence is a really large nonprofit healthcare organization with over 52 hospitals and over 1,000 clinics spread across 7 different states. And especially because we are a health system that has combined several different smaller systems over time to become the organization we are today, we have a wide range of vendors, specifically in the medical device space, different makes, different models. And so, as we think about third party risk, really trying to manage and oversee all of those different permutations becomes quite complex quite quickly. And I think an additional layer that Adam was speaking to earlier is really a lot of these medical devices are so specialized from a clinical standpoint that there may often be only 1 or 2 vendors in the market that are even making this type of machine to deliver the clinical care that we need. And so in that case, it's really imperative that that vendor takes cybersecurity quite seriously because there aren't a lot of other alternatives for us to look toward to be able to still deliver that same care to our patients.
Right. And again, I think you have some unique challenges. As large as you are, there's often that misperception out there that they're large. They again have all the resources. They don't have the same challenges as other systems, but you have different challenges. As you said, you were formed by the acquisition of many other systems that did not have the same controls perhaps in place in the policies and the wide array of vendors that you have to now deal with. Adam, back to you. What types of incidents or events have you faced over the past several years, and especially those that relate to third parties?
Yeah, I think if you can imagine it, we've probably faced it. And Katie's also on the front line of this and helping us remediate once we do get hit by these attacks. But as you mentioned, John, earlier, I mean, we're seeing an unprecedented level of attacks across the healthcare industry, and we're on the receiving end of a lot of those attacks at Providence. So external attackers trying to commit payer provider fraud, on the less impactful, I guess, the business operations side of the house, but just as impactful when you look at financial implications of being able to steal money that's due to hospital systems from our payers. So we've seen a lot of fraud attempts, a lot of social engineering enabled fraud attempts targeting our hospital system and the payers that we work with. We've also seen attempted ransomware attacks. Knock on wood, we've been able to stay ahead of these ransomware attackers through, really doubling down on doing the basics well at Providence and being very proactive in the way that we deal with security risk, managing security risk. We've also seen external attackers targeting our data, for data theft purposes, sometimes in conjunction with, or I suspect to be in conjunction with ransomware attacks. We've also seen denial of service attacks. Those still exist and they're still being perpetrated by hacktivist groups worldwide. We've had vendors on the third party side of the house bringing in infected laptops into our environment to perform maintenance on clinical devices and introducing malware into our environment as a result of that infected laptop being plugged into a system. We've also had third parties being hit by just about everything that I've talked about thus far, but I'll kind of zone in on number one, third parties being hit by ransomware. We've had some third parties that we rely on for clinical services that have been hit by ransomware attacks in the last several years. And as I mentioned before, those ransomware attacks have knocked these third parties offline for, in some cases, over a month. And you can imagine that can be very, very impactful for a hospital system that's relying on, for example, a third party to do lab work that gets hit by ransomware. And then we have to figure out, where are we going to get that lab work done? And then go forward. How do we work with that third party go forward to make sure that we're not accepting an inordinate amount of cyber risk by continuing to do business with that third party? And then lastly, we've had third parties hit with data theft. And these third parties, as business associates, are oftentimes then collaborating with us, where we're both kind of on the hook to regulators to report these incidents and make sure that the victims of these incidents, the patients that we care for, get notified that they were a victim of a data theft event, and then provide them with potentially credit monitoring or identity theft monitoring.
Yeah, thank you, Adam. Clearly, the risk from your business associates transfers to you, but it's not just the technical risk, legal and regulatory risk, all of that.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.